you get diagnosed with fibromyalgia, which is a diagnosis of I don't know, how could you possibly think the treatment is going to help you, right? It's not going to be enough. I'm so excited that you're here. And today we are talking about fibromyalgia. And fibromyalgia is not an acceptable diagnosis. It just isn't. Now, when I said this on TikTok, it caused quite a stir, quite a controversy. People were like, what do you mean it's not acceptable? Are you saying it's not real? How dare you say it's not real? It's people like you who make it difficult for us. Did I say that? Did I say it's not real? Or did I say it's not an acceptable diagnosis? Is it possible that maybe some of you aren't listening? I never said your symptoms aren't real. Hello, the title of my book is It's Not in Your Head. I would never say you're faking it. What I said and what I am saying right now, today, and forever is that the fibro diagnosis isn't an acceptable diagnosis. Why? Because you should want more. Now, if you're here today, you're here for one of two reasons. You or someone you love received the diagnosis of fibromyalgia, or you looked up all your various symptoms and maybe you're pretty sure you have fibromyalgia because, you don't feel good. Either way, you're in the right place. I'm here to tell you, do not accept this diagnosis. So today, I'll tell you what fibro is, how it's diagnosed, what the treatment is, and why all of that is not enough. And then I'll tell you what to ask. But first, let me tell you how to reach me and my team so that you know. For those of you who are new here, I'm going to mess up all these captions on the bottom, but that's okay. We're going to roll with it. So if you are watching us live, type the word in live. Let us know that you're here because it's great to see you. If you're watching us on replay, let us know that you're here on replay. That's awesome too. Type the word change below for access to the show notes and anything else. And of course, if you're on YouTube, don't forget to like and subscribe. Why not? It's free. Be kind. Do it. If you're listening on the podcast, watching, mowing your lawn or cleaning your dishes, as always, my hair looks amazing and I'm wearing a stethoscope that my wife bought me. And other than that, you're not going to miss anything. Follow us on Instagram or on Threads at The New Method, and always share this with the people that you love because they need to be game changers in their lives too. And for those of you who don't know me, my name is Efrat Lamondre. I'm the NP with a PhD. I empower people to realize that their symptoms are not in their head. Join the conversation if you're live. Ask us questions. We're going to answer it right away. And then also on replay, feel free to ask us questions. So let's jump in. What is fibro? Let's start there. I'm going to bring this up a little bit. Awesome. So what is fibro? Fibromyalgia, is called an invisible illness for two reasons. First, the symptoms are not visible. People can't see your pain. They don't see you have broken bones. Your labs are normal. You're in distress and no one can see it from the outside. It's invisible. But the second reason it's called invisible is because after a while, you feel invisible. After going from medical provider to medical provider, being told that you're fine, there's nothing wrong with you. Maybe you just need to exercise. Maybe you just need to lose weight. Maybe you should take an antidepressant. If you hear that enough over time, you will start to feel invisible. So that's why it's called the invisible symptom. Now, if you receive the diagnosis of fibro, you might for a moment feel like, oh my God, this is great news. Finally, someone sees me. I have a diagnosis. I'm not crazy. However, you'll soon discover the diagnosis of fibromyalgia makes you more invisible because it means that from this point forward, any medical provider will stop searching. You'll be branded as the patient with fibro and you will become even more invisible. Trust me, I know. I've been a practicing nurse practitioner for decades. Many of my colleagues literally roll their eyes when the patient comes in with the diagnosis of fibromyalgia. You're branded as a problem patient. What is fibromyalgia? Literally, fibro means tissue, mya, muscle, and algia, pain. So it literally means tissue muscle pain. It's not a really original name. It just describes what you have in a different language. Thanks for being helpful. So what is fibromyalgia? It's a disease that's characterized by having a lot of muscle pain, tenderness, fatigue, and other symptoms. Basically, your body hurts all the time. And fibromyalgia is the diagnosis given when someone has this chronic pain that can't be explained by anything else. Listen to what I'm saying, and I'm going to talk about it again. Fibromyalgia is a diagnosis given when they can't figure out what it is. This is called a diagnosis of exclusion. That means they test you for everything else, and then they say, I don't know. Let's just call it fibro. Sounds like a problem already. You're going to see why in a moment. So who has it? Who has fibro? About 4 million adults in the US, about 2% of adults in the US have been diagnosed with fibromyalgia. That's the ones who've been diagnosed. There are millions walking around in pain, just undiagnosed. The majority of the cases that are diagnosed are females, and most people are diagnosed on middle age, but it could affect any age. What are the symptoms? How do you know if you have it? The symptoms, they really vary from person to person, but at the base of it, the hallmark symptom is chronic pain all over that affects your daily life. That's the common denominator. And then there are some other symptoms. So you have this tenderness. The pain is associated with tenderness, a sensitivity to touch, and there might even be tender points. And it used to be that we diagnose people based on these tender points, but we don't do that anymore. Fatigue. Patients with fibro have profound fatigue. They're exhausted. These humans are tired all the time. The sleep disturbances. So the people with fibromyalgia are tired, but they can't sleep. A lot of them have insomnia. Cognitive disruptions, something called fibro fog. You can have memory issues, concentration issues, decision-making issues, and overall your mental clarity is affected. And it can get so bad that some people really can't work. They just disrupts their entire routine. And then you have other symptoms. You can have headaches, abdominal pain, bladder problems, depression, anxiety, dry eyes. But you kind of have to have this pain and this fatigue and this mental clarity issues. And then there's a million other symptoms that can happen as well. So the next question a lot of people like to ask me is, how do you diagnose fibromyalgia? Well, that's the thing. You don't really diagnose it. I mean, you do, but you don't. And that's exactly the problem. As I said earlier, it's a diagnosis of exclusion, which means your conventional medicine provider will do all of the tests, everything they can think of. And when everything comes back negative, that means they exclude all other possibilities. They will assume you have fibromyalgia. That's what a diagnosis of exclusion means. It means everything. It's an entire process. And it ends with, you can't find anything else, so you must have this. Okay, bye. Now, how could this be enough? This is why I say this cannot be enough for you. Of course, it doesn't make sense. This is why I'm telling you, don't accept your diagnosis, because just because they didn't find anything doesn't mean they should stop. But first things first. I always say this. If you're in this much pain, always first go to your conventional medicine provider, your PCP. Do not skip this test. Do not skip this step. And never, ever self-diagnose. Okay, because that could be really dangerous. No self-diagnosing, okay? So make sure you do all the tests your provider suggests. Don't skip it. Be as thorough as you can be. You don't want to miss anything. You don't want to miss a crazy pathology. Do the tests, do the imaging. And then if they land on fibro, you just say, thank you so much. And then you move on into functional medicine. And that is where you and I start talking. But here's what your medical provider will do initially that you really want to do. And of course, I already skipped a million of these buttons, so I'm catching up right now. Why? Because it wouldn't be alive if I got it all right. So if you go to your medical provider, this is the steps that they will do. Don't skip it. A physical exam. Of course, you can have a physical exam of your joints, your muscles, your tendons to see what's going on. Blood tests. I'm sure they're going to test you for diabetes, thyroid, anemia. Don't skip it. And if those tests are negative, they might do autoimmune issues, right? Checking for lupus, rheumatoid arthritis. And then all of these come back to normal. You're getting closer to the diagnosis of fibro. Remember, there's no test for fibro. The diagnosis is made when everything else is negative. Now, they might do some tests showing inflammation, and those might be elevated, but that's a problem too, because you could be inflamed for a lot of reasons. It doesn't really point you in any direction. And I do want to say that there is on the market a new test for fibro, and it's basically a test, again, a test for something called cytokines. I don't want to get into it too much, but honestly, I don't have much hope for this test because cytokines are elevated in a lot of people, not just in people with fibromyalgia, so I'm not really sure where this is going. But you know what? It doesn't matter. Even if the test can tell you that you have inflammation or if you have cytokines, it doesn't really give us the why. But why are you in pain? Why are you so tired? Why is inflammation happening? Why is all this pain happening? And more importantly, what can I do about it? So whether we have a new miracle inflammatory test out there or not, It doesn't matter. You're still in the same boat. If you're given a diagnosis of fibromyalgia, it's just a label and no answers with it. So the next question is, what causes fibromyalgia? Like, how did I get this? And that depends on who you ask. The usual answer would be like, I don't really know. Don't know. Maybe it's a genetic predisposition. And people will say it runs in families. Maybe it's a genetic predisposition, but I'm thinking, and I'll tell you more about it, that it's not genetic that you have fibro, but maybe it's genetic that you're sensitive to gluten or mold or something like that. And then you're genetically inclined to show it a certain way. And then there's some research that says that people with fibro have a different way of processing pain, that when they do MRIs of their brain, it shows that they're more sensitive to pain. But I question that also because I'm wondering which came first, the sensitivity to the pain, or now when you're looking at the MRI of a person with fibro, are you seeing that change? So no one really knows why in conventional medicine. But here's the thing. We're going to talk about the why, because once we start looking at different whys, we could see why fibromyalgia just doesn't cut it. Because so far you're getting that fibromyalgia is a disease diagnosed with nothing else is found. No one knows the reason why. And if you have a disease that is diagnosed because of we can't find anything and no one knows why, how effective do you think the treatment's going to be? It's not. There's no way it could be effective because you don't even know what you're dealing with. I hope that's clear to you, that if you get diagnosed with fibromyalgia, which is a diagnosis of I don't know, how could you possibly think the treatment is going to help you, right? It's not going to be enough. So let me tell you how fibromyalgia is treated traditionally. First is patient education. Now, I am not making this part up. This is literally in the guidelines. The very first recommendation says to spend time explaining to the patient what the disease is and the uncertainty of where it came from and the uncertainty about how to treat it. This is a quote. I can't make it up. This is really a quote of the first step. And then, of course, there's education about sleep hygiene and exercise and stress and the usual. But the first part of education is letting people know we have no idea what's going on with you. The second step for conventional medicine is to address what's called the comorbidities. The next step of treatment is to address the diabetes or obesity or hypertension, what else is going on. And the third step is medication. Now, it's not medication for fibro because remember, we don't know what causes it, so we don't have medication for it. But instead, we start medicating for all the symptoms around it, right? So we're going to medicate antidepressants because you're going to be depressed because you're exhausted. We're going to give you muscle relaxers. We're going to give you anticonvulsants to help you with pain. Basically, medications are going to be given to you to help stop the symptoms of fibro. Now, you know by now that I am not against taking medication. Of course, you don't get extra points for suffering. Take what you need. But none of this actually helps you search for answers. So it's time to think different. Hopefully by now, if you got to this point of the episode, you're getting the sense that this is not where I want you to be. I do not want you to have a diagnosis of exclusion. I do not want you to get medication thrown at you. I want you to have answers and find the reasons behind why you're feeling this way and getting your life back. And I am not selling you a 90-day protocol miracle cure. Okay. I don't care if you sign up to work with me. In fact, it's pretty hard to book a consult with me. I make it pretty hard to do that. I'm talking about this because I care and I want everyone to have access to information. Here's the bottom line about fibromyalgia in functional medicine. The bottom line is fibromyalgia is not the end diagnosis. It's actually just the beginning of the journey. Let me tell you what I mean by this. And by the way, this is just how it is in functional medicine. If you have fibro, in my opinion, you fall into one of two groups. You're either pre-disease, and I'll tell you what that means, or differently diseased. So if you're fibro, feeling like fibro or diagnosed with fibro, you're either pre-disease or differently diseased. Let me tell you what I mean. Pre-disease, some of you walking around with all these symptoms of I don't feel good, I'm exhausted, I'm tired, and all your labs are negative, it's just because you're at the beginning stage of the disease, the stage I call pre-disease. And the reason your lab results are negative is because they didn't have time enough to become positive. Give it a few more years and they will become positive. These are the patients I call pre-disease. These are the patients who say, man, 5 years ago, I was told I have fibro, and today I have this, lupus, rheumatoid arthritis. 5 years ago, their blood results were negative, and if they do nothing about it, give it some time, it'll all come back positive. It's just like if you have pre-diabetes, you can have pre-autoimmunity. This is what sometimes referred to as seronegative autoimmunity. That means you look like an autoimmune patient, but all your blood markers are negative, so you're fibro, pre-disease. The second one, which I find just as fascinating, is what I call differently disease. And this is the group of people in fibromyalgia who do not have an autoimmune disease, and they will not have an autoimmune disease. But the reason they don't feel well is because they have issues that conventional medicine doesn't test for. Okay, so just like every chronic illness, fibromyalgia has triggers, right? It could be physical, emotional trauma, infections, hormonal changes, stress. And these triggers can lead to an overactive pain response. Pain is our main issue with fibro. So let's talk about these triggers, because finding these out can make all the difference. One of them you might know by now because I talk about it all the time. Your microbiome imbalance. Your body's microbiome in your belly, trillions of bacteria and other stuff, and they're in charge of everything. They are literally in charge of everything. Your immune response, hormones, neurotransmitters, infection control, all happening in your belly. This microbiome, if this world loses its balance, it messes with our ability to manage pain, deal with anxiety, depression, spreads inflammation all over the body, causing muscular discomfort and joint pains. So what looks like fibromyalgia may be a microbiome issue. Or if you have leaky gut, fancy word is intestinal permeability, or SIBO, small intestinal bacterial overgrowth. Again, these are people whose microbiome are not balanced, and you can be experiencing it in your entire system, thinking you have fibro, but you have a microbiome issue. Number two, this could be a food sensitivity. And I did a whole talk. There's a difference between food sensitivity and allergies. You may not be allergic to pineapple, but every time you eat it, you might get a headache. Not necessarily an allergy, it's a sensitivity. Or it might make you tired, or it might make you achy. So they are very distinct from allergies. It's not an allergy that you need an EpiPen for or Benadryl. Food sensitivities can make you feel so unwell a day or two later if you're intolerant to the food, even though you're not allergic. So you might look like a fibromyalgia picture, but in fact, you might just be eating something every single day that's making you feel horrible and you don't even know it. Of course, it could also be a thyroid issue, something you want to look into. It could be lack of certain nutrients. Vitamin D is low, maybe your B12 is low. All of these things can make you look like a fibromyalgia picture. Adrenal fatigue. I did several episodes on adrenal fatigue. I won't spend too much time on it right now, but everyone thinks stress is about too much cortisol. But in fact, chronic stress over time actually depletes your cortisol levels, making you feel tired, depressed, unmotivated, in pain. Sounds like fibro. Yeah, it could be adrenal fatigue. And then there's something called mitochondrial dysfunction. Again, I don't want to get too deep into it, too technical, but mitochondrial dysfunction basically means the batteries of your cells are going haywire. The mitochondria are the powerhouse of the cell. It's the reason we're alive. It's the reason we're not sick when they're functioning. And if these guys get damaged, nothing feels right. So targeting therapies to help the mitochondria could really be the missing piece. And there's mold toxicity. Mold is everywhere. I did another episode as well about this. And not all molds are bad, and not every person is affected by mold. But there are millions of people who are mold toxic. These people are unable to detox their body from mold, and it creates a buildup. And guess what that feels like? Tired, in pain, fatigue, fog, all of the things we associate with fibro. Lyme and other tick-borne disease. Again, chronic Lyme is a real thing. And these people, again, if it's not managed, are going to look like a fibro picture because it infiltrates every part of the body. So this is not even the most comprehensive list. It's a pretty good list, but there's more. And I hope you're beginning to understand that if you've been diagnosed with fibromyalgia, or you think that's your diagnosis, conventional medicine and testing is just your first stop. Their job is to rule out other diseases. Your job is not to accept this diagnosis and to keep hunting for actual answers and maybe different types of diseases or triggers that your medical provider is never going to test you. So here's the bottom line. And of course, I skipped all of these things. Here's the bottom line. The bottom line is do not accept fibro as your diagnosis. If your medical provider did all the tests, that's awesome. He or she is an amazing human. It just means they didn't find anything. That's good news. But that just means you keep going. You do not accept it. Now is the time for functional medicine. Whether you work with me or someone like me, we can help you go through all of these potential triggers and help you find the root cause and alleviate your symptoms. And wherever you look, we're there. Why? Because this is what we do with our lives. We want to empower patients. So I want you to keep hunting until you get your answer. Why? You already know the answer. You already know the answer because you always knew there was a better way. I look forward to seeing you next week.